All right, 6 minutes before the bottom of the hour, 30 minutes before the top of the hour. 5 babies at a suburban Chicago daycare center now sick with the measles, and more than a dozen could still be at risk. All of the sick children are under a year old and too young to get vaccinated. But health officials say some vaccinated adults could also be at risk.
This is a new study finds that comments online by who knows who's writing them are often seen as more credible than even the CDC's recommendation. So who do you know to trust? Dr. Marc Siegel from the Fox Medical Aid team joins us right now live. It's interesting. They did this survey, and they talked about it in an advertising journal, and they said, okay, you got the stuff from the CDC and some other organization, all official, but then as many people trusted the comments from anonymous people they didn't know who were fake than the CDC.
3 out of 4 people, Steve, go online to get their health information. That's where the problem starts. And I think it's because parents are very nervous and worried about their children, and they see a change in behavior, and they don't want to hear, look, you're imagining things. So I think as physicians, we first have to understand that if this problem exists, maybe we're not doing a good enough job taking people seriously. We can't be dogmatic. We have to hear people's fears. We have to respond, whether it's fear of measles, fear of vaccines, because if people go to the internet, they're not going to find the answer, the right answer. It's too contradictory stuff. It's a Wild West.
Let's separate the fear from the fact here, doctor. So what do we need to know about vaccines? Because I'm a mom, our kids are still, at the age where they're getting vaccinated. What do we need to know? Well,
I think vaccines are predominantly safe, and I think they've been for great public health good. I think that complications are very, very rare. Side effects are very rare, but I don't think they're non-existent. So that's what I mean when I say I have to listen to a parent. If a parent thinks that there's been an effect of a vaccine, a side effect, I have to listen to that. I can't dismiss it. Sure. But in the vast majority of cases, the vaccines have done tremendous good. This MMR vaccine, the measles, mumps, and rubella vaccine, it has cut down on deaths from measles worldwide by 75% over the past 14 years. On the other hand, Elizabeth, the country of Japan uses just a measles and rubella vaccine. They don't have mumps in there because they feel that mumps increases the risk of side effects. So these things have to be debated. They have to be discussed. But on the whole, vaccines help enormously.
And what is the Internet? It's a way of talking to other people, get feedback. The things you used to do in the supermarket or at the sideline of a sporting event, you're now doing online. But at least you knew those people. You do point out some principles and things that every family should keep in mind. Number one, get a pediatrician that you can trust, right?
I think that's the most important. You need a guide. I called it in my book on fear guides. Somebody that's going to tell you that you can believe in, a doctor you can believe in, not a dogmatic doctor. A doctor hears you and says, look, I've given this to thousands of patients. This is what you can expect. This is what the issues are.
Take what you can, take what you read with a grain of salt, and potential downside, big upside.
And the point that Steve made, though, Brian, is of course people have to be able to state their feelings. We can't suppress people's opinions. That's not a good idea. Never a good idea.
Never a good idea, but reigning in fear is the problem here. And
well, because there are authorities. There are people with a lot of experience, Elizabeth, people who know what they're talking about, who have a lot of experience. We have to listen to them, too.
Well, he's got a lot of experience that way. We invite him on the couch every week. Dr. Siegel, thank you very much.
I love the red, by the way, for Heart Month.
That's right. You're going to be talking about that over the weekend, right?
Absolutely, on the house call.
I'll be standing by for that, doctor. Thanks for your
Great to see you.